Let's continue with visual diagnosis inspection. Now we talk about the face. Visual diagnosis of the face. When we visually diagnose the face, we must note changes and distribution in the colors on the face. We must also observe the moistness and the quality of the skin and whether there is radiance. Visual diagnosis of the face is fairly straightforward, as the face is not usually covered with clothing. Furthermore, it is the face that we look at when we talk to the client. It is important, though, to pay attention to the lighting condition in the room and to take into account the fact that many women use makeup, which can shroud the true colors of the complexion. Both these factors can complicate the diagnosis. Some therapists, therefore, ask their patients not to put on makeup before the consultation. Account must also be made for the natural difference in skin colors between various ethnic groups. A pale complexion, for example, will be darker if a person from Pakistan compared with a Norwegian. The facial color that a person is born with are called their guiding colors. The colors that the face can manifest because of changes in temperature, physical activity, mood swings, and others are called visiting colors. So let's discuss further the colors of the face. Facial colors in relation. There are different diagnostic levels or models for analyzing the colors of the face. Five-element acupuncturist place great emphasis on the client's facial colors, especially the area between the eyes and temples. This can give an indication of which constitutional type the person is. Furthermore, changes in facial colors can reveal which element or phase is in imbalance. Here we have a table summarizing the observation and the significance of the different colors of the face in relation to the five phases. If the face color is white, it could mean the person has a metal constitution or an imbalance in the metal phase. If it's blue or black, the patient has a water constitution or an imbalance in the water phase. If the face is red, the patient is of fire constitution or there is an imbalance in the fire phase. If the face is green, the patient has a wood constitution or has an imbalance of the wood phase. And if the person has a yellow color, yellow face, then the patient has an earth constitution or an imbalance on the earth phase. Some colors are more favorable and some are more serious, depending on the phase of the color that the color represents. It is necessary to relate the colors to the Sheng and Ko cycles. If the person manifests a color in the face that resonates with the mother face, it is called a conforming color, and this is a positive sign. If they manifest a color that resonates with the sun phase, this is a slightly conflicting color and is seen as being a negative sign. This, though, is not as bad as if it is a contradictory or a very conflicting color. A conflicting color will be when the patient's face manifests the color of the face that should be controlled by the face in the closed cycle. It is even worse when the patient manifests the color of the face that ought to be controlling the face of the patient or the face that resonates with their disorder. Here we have a table tabulating the conforming and contradictory colors in relation to the five faces. So if the face color is yellow, it is conforming in metal type. It is very contradictory in water element. It is contradictory for wood, and it is slightly contradictory for fire. If the face color is white, for earth, it is slightly contradictory. It is it is a conforming color for water element type. It is a very contradictory color for the wood and a contradictory color for the fire face. If the face color is black or dark, it is contradictory to the earth face. It is slightly contradictory to metal, conforming to the wood, and very contradictory to fire. If the color of the face is green or green and blue, it is very contradictory to earth, contradictory to metal, slightly contradictory to water, and conforming to fire. If the face color is red, it is conforming to earth, very contradictory to metal, contradictory to water, and slightly contradictory to wood. Now, let's discuss further facial colors in relation to the 8 principles. The observation of the facial color is also an important tool in more classical Chinese medicine and TCM. The colors of the face can be used as an aid when differentiating the 8 principles. The colors of the face can help to reveal whether there is an internal or external condition, whether the condition is deficient or exists, or whether it is hot or cold. The colors of the face can also give an indication of which type the qi are present. The facial color will normally match the underlying pattern of imbalance. For example, if a person has a hot condition, then the face will be red or reddish. If it is not, there can be various explanations. One of the most common reasons that the colors in the face do not correspond to a pattern of imbalance is that the patient is manifesting multiple patterns simultaneously, and not all the colors can manifest at the same time. For example, a patient with excess in heat, a spleen qi deficiency, and liver qi stagnation will not have all the 3 colors simultaneously. Most often, we only see one color. When the color of the face is not consistent with what we expect to see, this can be used as an aid to understanding the pathological dynamics that are taking place. If we expect to see a dark color because the person is manifesting a blood stagnation, but their face has a pale coloration, this could tell us that the root of their blood stagnation is Qi deficiency or blood deficiency condition. This will then influence our approach to treatment, and we may well utilize a different treatment strategy than we would if it were a purely Qi stagnation. The facial color can also be affected by things such as the person's occupation. For example, if they work outdoors, the change in color could also be due to the weather, the season, or the person's emotional state. There may also be situations in which there are conflicting signs of heat and cold if the patient's facial color, their symptoms and the tongue and the pulse. This can be seen when there is false heat or false cold. False heat and cold arise when the patient's yin and yang are in the process of separating. This is always an ominous sign. It is not only the color itself that has a diagnostic significance. The intensity of the color, its depth, and the radiance and moistness of the skin are also of relevance. Let's discuss further intensity and depth of the colors. When diagnosing the face, we have to observe the qualities of the facial colors. The colors will be more superficial in an exterior condition. There will be an appearance of the color almost floating on the surface of the skin without the color having any root or depth. Interior conditions usually manifest with more deeply rooted colors. These colors will have depth, appearing not to be lying on the surface of the skin. A deficient condition will result in weaker or more dilute colors. These colors will not be as intense and concentrated as the colors in an excess condition, where the colors are more substantial. In addition to intensity and depth of color, moistness must also be taken into account as well as whether there is radiance or the color seems dull, matte, and lifeless. Now let's talk about radiance. The facial complexion should have shone in the same way that the pulse and tongue do. This means that the complexion must have radiance. The presence of shine is always a good prognostic sign. Conversely, a lack of shine is always interpreted as a negative prognostic sign. Now let's move on to moistness. In the same way that stomach chi gives the pulse a smooth and slippery quality and the tongue a thin rooted coating, stomach chi ensures that the face and thereby the complexion has a slight moistness. If the complexion appears to be matte, dry, and without luster, it will be a sign of stomach chi that the stomach chi is injured and is not producing sufficient jinye. Here we have a table showing the face color in relation to the 8 principles. So if we observe that the face has a superficial hue, it indicates an exterior condition. If the facial color has a deep hue, it indicates an interior condition. If the face color shows a weak and diluted colors, it indicates a deficient condition. If the face color is strong and intense, it indicates an excess condition. There is red and ruddy hues, it indicates heat. If it's white, pale, or blue hues, it indicates cold. If we see clear, bright colors, it could mean young conditions. And if we see matte and dull colors, it's yin conditions. It is also necessary to note the distribution of facial colorations. The individual areas of the face relate to various Zhangfu organs. Now let's discuss normal colors. The normal color will, as stated previously, depend on the person's ethnicity. Northern Europeans' facial color should be a mixture of white and a slightly red color. Adjustment to this base color should therefore be made for different ethnic groups. Despite differences in skin colors between the various ethnic groups, there will still be the same dynamics and the same variations in facial complexion. A slightly red color indicates that there is sufficient heart blood. The facial color should have luster and radiance, indicating the presence of Shen. The color should be subdued. This means that it should not be too obvious. Huang Daiqing, Su Wen in the Yellow Emperor Classic, Simple Questions, in chapter 10 states that The color should appear as if it is being seen through a thin piece of silk. This means that the color should be seen through the skin. That is, the skin itself should not have the color, and the color should not appear to be lying on the surface of the skin. The skin should be slightly moist, and the color should have a slight luster. The normal color will be seen in a person who is healthy and in balance. If these colors are seen in a person who is ill, this in itself will be a good prognostic sign. This means that the disease has arisen recently and has not taken root. It indicates that the disease has not injured the qi, the blood, jinye, and the zangfu yet. Now let's move on to pathological colors. Let's start with white. The white color is seen where there is qi deficiency, yang deficiency, and blood deficiency, and cold. The white color can be dull and matte when there is yang deficiency, dull and pale or almost grayish when there is qi deficiency, a sallow wan white that is slightly yellowish and without luster when it is blood deficiency or sometimes phlegm, an almost bluish white color when cold is present. Next, we have gray color. A grayish white, sallow complexion that is slightly dry can sometimes be seen in the face when there is phlegm blocking blood from nourishing the skin. Next is qing, or the green-blue or green color. The green or green-blue color is seen when there is pain, when there is stagnation of qi, especially liver qi stagnation, or when cold creates stagnation. It can also sometimes be seen when there is heart blood stagnation. Next, we have the blue color. The blue color is often classified as being a shade of qing. It will usually be seen when cold stagnates blood. It can also be seen in the area between the eyebrows of young children when there is liver wind. If the entire face of a pregnant woman is bluish, this is a sign of blood stagnation and yang deficiency. This is an adverse sign. Next, we have here the red color. The red color will always indicate the presence of heat. Excess heat will cause the cheeks or the entire face to become red or ruddy, whereas deficient heat will result in the cheekbones and the region around them becoming red. The red color in yin deficiency will also be thinner and look more like makeup brushed on the surface of the skin. Heat can also result in the eyes becoming red. Next, we have the black color. The black color includes a very dark complexion as well as black. The dark complexion will be a sign that there is kidney deficiency, cold, damp phlegm, or blood stagnation. When there is kidney yin deficiency, the skin will be dark and dry. When there is kidney yang deficiency, the skin will be dark and moist. Damp phlegm or damp cold can result in the area around the eye becoming dark. If the color is very dark, then there may be blood stagnation. Next, we have here the yellow color. The yellow color is seen when there is blood deficiency, damp cold, and damp heat. Blood deficiency can result in the face being pale and wan with a slight yellowish tinge. Shen accompanies blood as it circulates around the body. If there is blood deficiency, the face will therefore lack radiance and luster. The yellow color resonates with the earth phase. When there is spleen chi deficiency, it can sometimes manifest with a yellowish hue in the facial complexion if there is dampness and at the same time. Damp heat imbalances will also manifest with a yellowish tinge to the face. Damp heat can arise when there are spleen imbalances, but also in other organs. For example, jaundice is often seen when there is damp heat in the liver and gallbladder. The yellow hue will often be seen in the facial complexion as well as the sclera of the eyes. The more heat that there is present, the brighter the yellow color will be. If there is damp cold, the complexion will be darker and more smoky. If the face is dry and yellowish without radiance, there may be a pathological heat in the stomach or spleen. Next, we have the purple color. The purple color is seen when there is extreme blood stagnation and poisoning. As with the tongue, the purple color is differentiated according to whether the complexion is reddish purple or bluish purple. Heat can condense blood and thereby stagnate it. This will be seen with a reddish purple complexion. Cold will congeal blood. In this case, facial complexion will be bluish purple. Here we have a table showing the different facial colorations and their significance. If the facial coloration is normal, then no disease or a disease of shorter duration and with good prognosis. If the facial coloration is white, there is chi deficiency, yang deficiency, blood deficiency, and cold. The facial coloration is red, it indicates heat. If the facial complexion is blue or green, it indicates pain, chi stagnation, cold, heart blood stagnation, or wind. If the facial coloration is yellow, it could mean there is damp heat, damp cold, or spleen chi deficiency. If the facial coloration is black, it indicates kidney yin deficiency, kidney yang deficiency, damp cold, damp phlegm, or blood stagnation. If the facial coloration is purple, then there could be blood stagnation or poisoning. If the facial coloration is grayish, then there could be phlegm. Now let's move on to the facial areas. In classical texts such as the Wang Di Nei Ching, the Su Wen, and the Huang Di Nei Ching Ling Shu, there are descriptions of the facial areas and the internal organs that these areas relate to. An imbalance in the Zangfu can manifest with changes to the colors of the skin in these areas. There are significant discrepancies between these two texts, as well as between other sources with regard to the diagnostic relationship of the various areas of the face and internal organs. Figure 1.1 shows the position of the Zangfu organs in the face to Wang Ding Qing Ling Shu difficulty 49. But as written, there are many different interpretations of the diagnostic significance of these areas. Now let's talk about tics. Tics occur when there is internal wind in the muscles. The wind makes qi become chaotic in its movement and thereby lose control of the muscles. The wind will be internally generated and will always be related to liver imbalances. This also explains why tics can often develop or worsen when a person is stressed or emotionally affected. Here is a facial diagram showing the position of the Zangfu organs in the face according to the Huang Di Ni Ching Link shoe difficulty 49. Okay. The forehead will show the lungs. Thank you for your attention.